Why sitting in the wrong posture causes spine pain. The cruel truth nitrogen monoxide, one tells you. The story begins on a Monday morning. Mondays are already heavy, and that day my clinic was even more crowded than usual. People grimaced and held their shoulders. Some held their necks. Some held their backs. Spinal patients, they came in waves like ocean waves. And then a girl appeared, about 29, 30 years old, hair tied up, glasses, petite. But what caught my attention was not her appearance, it was the way she walked into the clinic. She couldn't stand up straight. With each step, her body leaned to one side. Her right hand hugged her back tightly, as if letting go would cause everything to collapse. I asked, "What are you doing that hurts so much?" "Heavy lifting. Lifting things. Falling." She took a breath, then answered in a voice that was almost trembling. "Yes. I just sit, doctor. I just sit and work. Just sit." The answer sounded light as a feather, but her eyes were heavy as a rock. I checked. Her back muscles were as stiff as a log. Neck muscles shortened and tensed. Shoulders rounded forward. Spine slightly deviated to the right. Hip rotation. Pain radiating down to her buttocks, a sign of a pinched nerve. All I asked was one question. "How long do you sit and work every day?" She answered immediately, "Probably 10 hours. Some days 12 hours. I continued, "How do you sit? Describe it." She smiled wryly, probably a little bent. "I often curl my legs up on the chair. Sometimes I lie down on the swivel chair, doctor." And that's when I knew. Her spine isn't broken. It's been mistreated for too long. Fact number 1. The human body is not born to sit. Your spine is made to stand, walk, run, move, rotate, bend, reach, not to stay in the same position for 8 to 12 hours. Sitting for too long is like forcing a machine that is supposed to work in multiple directions in nature to become a fixed block of concrete. Sitting for a long time does. Back muscles are stretched. Chest muscles are contracted. Abdominal muscles are weak. Gluteal muscles are clinically dead. Disc dehydration. Nerve compression. The cruel truth is, sitting in the wrong position destroys the spine more slowly than an injury. Injury happens once. Sitting in the wrong position happens every day. For sitting positions that kill the spinal fastest: 1. Sitting hunched over, head tilted forward. This is the most common posture of office workers. If you just bend your head 30 degrees, the pressure on your neck increases from 5 to 6 kilograms to 18 kilograms. Bend 60 degrees to look at the phone, the pressure increases to 27 kilograms. That's why you have neck pain, shoulder pain, and upper back pain. 2. Sitting with legs crossed. It looks nice, but it twists the pelvis, causing the spine to misalign. Consequences: the right side hurts more than the left. The lower back muscles are unevenly stretched. The ligaments are pulled out. 3. Slouching. Leaning too far back in the chair. You think you are relaxing, but in fact, the lumbar discs are compressed many times over. The abdominal muscles are shut down. The back muscles carry the entire weight. 4. Sitting correctly but sitting for too long. Even with the correct posture, if you sit for more than 45 to 60 minutes continuously, the discs lose water. The muscles lack oxygen, poor blood circulation. Lactic acid is produced. Pain. Your body is not a statue. Why does sitting incorrectly hurt so much that you can't stand up? There are 3 pain mechanisms that 90% of people do not know. Mechanism 1. Some muscles have to work 200 to 300% capacity. Neck muscles, shoulder muscles, lower back muscles have to tense for many hours to keep you sitting. Long tense, tired. Tired, greater than inflammation. Inflammation, pain. Mechanism 2. Some muscles gradually weaken over time. This is the silent enemy. Weak muscles equals spine loses its protector. Weakened muscle groups include abdominal muscles, gluteal muscles, mid-back muscles. When these muscles hibernate, the force is concentrated on the disc, bulging disc, greater than irritated nerves, greater than pain radiates down the leg. Mechanism 3. Blood supply is reduced by 40 to 60% when you sit for a long time. Muscles lack oxygen, greater than lactic acid is produced, greater than deep pain, dull pain. That is why the more you sit, the more pain you feel. So, how to reduce spine pain? You cannot cure it if you do not change the way you use your body. I want you to remember the golden rule, 2082. 20 minutes sitting, 8 minutes standing, 2 minutes walking, stretching. Applying this principle correctly for a week, 80% of my patients have significantly reduced pain. Correct sitting posture only 5 points, but save the whole spine. Head, neck straight, shoulders relaxed, back slightly propped, legs perpendicular to the floor, screen at eye level. Use a lumbar pillow if the chair does not support it. 5 must-have exercises 7 minutes at night. Reduce pain after 30 days. Door stretch, side neck stretch, cat-cow, lower back stretch, child pose, glute bridge or light squat. Just stick with it for 30 days. Your body will be completely different. What to eat for spine pain to reduce pain and anti-inflammatory? This is the most underestimated part, but it is the most powerful. 90% of pain is caused by inflammation, and inflammation comes from diet. If you eat wrong, inflammation increases 50 to 70%. If you eat right, inflammation decreases in 14 days. 6 strongest anti-inflammatory food groups for back pain. 1. Omega-3, salmon, mackerel, sardines, chia seeds, walnuts. Reduces inflammation like turning off the fire in the body. 2. Dark green vegetables, kale, spinach, broccoli. Strong antioxidants, supports discs. 3. Vitamin C orange, kiwi, strawberry, guava. Helps regenerate collagen around the disc. 4. Good fats, olive oil, avocado, almonds. Helps reduce inflammation throughout the body. 5. Calcium plus vitamin D eggs, milk, small fish eaten with bones. Helps strengthen bones, healthy muscles, reduces back pain. 6. Foods with anti-inflammatory enzymes, ginger, turmeric, pineapple. 3 powerful natural anti-inflammatory warriors. Avoid things that make you pain more the more you eat. Sugar, soft drinks, fried foods, fatty red meat, fast food, alcohol. They increase inflammation. Suggested menu to reduce inflammation. 7 days. Morning, oatmeal plus chia, yogurt plus kiwi, fried egg plus avocado. Lunch, salmon plus cauliflower, chicken breast plus salad, tofu plus mushrooms. Dinner, chicken soup, mackerel, boiled vegetables plus nuts. Drinks, warm lemon water, turmeric tea, ginger tea. Combining diet plus exercise plus correct posture equals sustainable pain relief. End of the story. Remember the girl from the beginning? For weeks later, she came back for a checkup. She smiled brightly. My pain is gone, doctor. I didn't expect that just changing my posture and eating habits would change so much. And I want to tell you this. Spine pain is not fate. It is just a reminder that your body needs better care. If you apply what I share today, I believe your spine will recover stronger than you think. And if you find these things valuable, remember to subscribe to the channel to watch more extremely important health content that I will share in the future.